Welcome everyone. Today we have very important topic because every moment we are trying to engage with real life problem. Healthcare is a really big problem right now in Asia Pacific. It's not only Malaysia, Indonesia, Vietnam, many countries right now suffering for healthcare system. Even though in South Asia, country like Bangladesh, Pakistan, India, Indonesia, many countries actually we are suffering for this COVID-19 situations. How we can fix this problem? How we can create better policy for our healthcare? How we can remove uh, like all of the corruption from our system? How we can get better benefit? Because you have to understand when I discuss, because as I lose my family member for the COVID-19, my feelings something special for this COVID sessions, and how they are suffering with their healthcare system, because many people do not get vaccine, many people do not get oxygen, many people do not get proper healthcare support even when they're dying. Even young people, they are dying, even the mothers, even their children, they are also dying for this COVID-19 situation. As Asia Pacific has 40% populations, they live in Asia Pacific around the world, so it's a highly density populated places. So here sufferings also very important, and I request to the global community how we can work together. Already for vaccine, we start working with the Transhumanist Party. So Transhumanist Party is already, we know the US government, they share their excess vaccine to the Asia Pacific community. And beside that, like 40% populations around the world, they live in Asia Pacific, more than 3 billion people. So it's not enough, so we need to work together, we need to solve this problem. I know this is difficult, but I know if the whole people work together, this is not a impossible. Especially, I'm a son of a freedom fighters. uh, he was a freedom fighter for Bangladesh, and I know how USA people, not only the global community, they helped the freedom fighter in 1971. Even they arranged concert and many more things. So in present situations, we need to work together, collaborate together. And I'm not looking for money, I'm not looking for anything, because whatever we make, we are also distributing through our World Talent Economy Forum and School of Talent Economy initiative. But I have limited like capacity, I do not have everything. We need team, we need to work together. Let's say like Transhumanist Party like chairman, he also joined in our team. Even the many important person from Asia Pacific, they join our team. We are working on vaccine diplomacy, as well as we try to solve the educational problem and healthcare problem, because these are the major problem right now. So thank you for joining today's special episode. So I want to start from Professor David Smith. You are a strategic, you have excellent analysis on the healthcare system and different technological aspects. What we do right now, how we can solve this problem, and how we can develop some futuristic strategy on medical and health science.
Well, health science and healthcare as a national concern is very interesting because it's actually a fairly new concept. Before the 20th century, you really did not see much organized healthcare delivered anywhere in the world. It was very specialized, but beginning in the 20th century, you began to see it become more of an imperative, and you saw nations and others begin to put in place healthcare organizations to speed the adoption of healthcare as it's gone forward. And I was fortunate to be chosen as one of the 7 futurists in the last issue of Business Week to talk about what would be the major trends of this century. And the major trend I talked about and forecasted was this century is going to be about the age of bio. And bio is a huge impact in the topic areas we're talking about today. It has applicability in others outside of it, like computing and many other things. But as you begin to look at what we're doing today, it has set the standards that the 21st century is going to really be the bellwether of advances in healthcare. as we see them going forward. In the latter part of the last century, beginning with David Klemmer, when he mapped the genetics of the fruit fly, going through mapping the human genetic, and now beginning to understand how to manipulate, how to produce drugs that are based against the genetic code, like we were seeing with COVID, and others like that. It's opening up a whole new realm in healthcare. Going back hundreds of years, healthcare was kind of, you had an event, let's try to fix you. So in the United States, that approach was called fee for services. You go to the doctor when you're sick, they get paid to get you partially well, and then that's how the healthcare system worked. Why were they paid to get you partially well? Well, if you're all the way well, they don't make money. And you see that kind of going across whole trends around the world where they're in this fee for services arena. Where I believe we're headed around the world, and definitely in the United States, we're going to what's called quality-based medicine, value-based medicine, where the goal is to do things to keep you well. And so in the United States, there's 21 quality measures that you have to do with your patients for you as a physician, as a medical practice, to make as much revenue as you can. If you do not do these quality measures, you make less money as a provider. Um, and it's a very interesting way to encourage the movement towards quality-based, value-based medicine. I believe with the advances we're seeing in science, that the move to quality-based medicine is perfect for this time, because there's many advances we're seeing right now. Today, I can grow in labs 17 different body organs and begin to look at taking what we've grown in a lab and using in human beings. I can begin to go and produce personalized medicine cocktails directly aimed towards an individual, and there's nuances. One of the phenomena that we've really gotten into is the last 50 years is something called multimodal disease. Many times in the past, you had one disease, but now we have multiple diseases that an individual has that we're beginning to treat in this way. And that's really a fairly recent phenomenon of looking at. We might have in the past, but we didn't have the science in place to really understand it, to deal with it and treat with it. So we're at a time where our ability to diagnose, to use the science to understand in great detail what is going on, to be able to look at it from not just a cause and effect basis, but how does this work in totality with what you're doing? Many of the leading medical schools today are teaching community-based healthcare as opposed to doctor office and hospital healthcare. They're beginning to teach the impact of food. They're beginning to teach the impact of climate change. They're beginning to treat the impact of the other things in the community that can impact and influence your health. So it is becoming more dynamic. And part of the real drive to this is this multimodal disease states that we're in today. It's a very exciting time. I would have loved to have been born in the last 10, 15 years, because in my lifetime, I would see the full benefits of this. And it's very exciting to me for the young generations today, because I believe we're going to see the younger generations, healthcare life expectancy dramatically extended outside of uh, accidents and trauma. Um, you know, in the 20th century in the United States, healthcare average age expectancy increased by about 15 years. Uh, and then in the latter part of it, we saw the average life expectancy increase by about 30 years. That is a lot of change in just a little bit over 125 years. And but we're going to see even greater change of that life expectancy going forward. And it creates issues in healthcare. It creates issues on the social policies of nations, the healthcare policy of nations. Um, how uniformly is it distributed? Um, how do we deal with it when you're going to go through an average of, if I go and live to 150 years old, you're going to probably go through an average of 50 to 70 career changes during that time. They might be promotions, they might be new jobs, new industries, industries that didn't exist earlier. But these are all the types of impacts that you're going to see based on the advances in science and healthcare. And it's a great way to start a discussion because the impacts of this are so broad on both policy, your personal life, on economics, even in global commerce. It's going to have a dramatic impact because the magic spot where people market to has just shifted and gotten bigger. And so there's tremendous impacts. But I think that's a good place to start, and I look forward to hearing what the others have to say.
Thank you for your excellent analysis. Mr. Jamesid, how do you want to analyze present situations? And especially, you have any specific thought how we can reduce defend corruption from healthcare system?
Thank you, Sharif. Another wonderful topic, and thank you, David, for a great lead. Because what we do have, and he alluded to this, is we have a sick care system now. We don't have a healthcare system. So, and the doctors, the medical providers, are incented to in the wrong ways. So they make more money if we stay partially well. And so, changing it to a healthcare society would be to the benefit of all, except for things like insurance companies. And not against insurance companies, they provide a service. But when it combined it with the healthcare system in the way that we have done in the United States, you have built-in corruption. And this doesn't mean that someone's taking money and putting it in their pocket. This just means that they're disincented to do the right thing. And they're incented to make more money for people that aren't really helping people stay well. So if we could change the structure of the society, which is a big if, it's like making rhinoceros soup will catch a rhinoceros, as Donald would say. It's a hard thing to change the system that we have. One of the things that we can do is have a policy of universal health care where everyone is allowed to live a life of quiet dignity. And so that you aren't bankrupted by getting ill. By getting sick, you don't destroy people's lives and the lives of those who care about them. So we have a structure in place that is causing people to lose their homes because they get sick. Now, this is not a just society. It's not a just system. So you have to make systemic change. And how do you do that? You have to have a lot of people advocating for themselves. Change yourself first. Don't think that it has to be this way. And elect officials who are in agreement with your perspective that this has to change. Do not vote for someone who says, we like it the way it is. Vote for someone who wants to change the way it is so that it's optimal rather than suboptimal, and where the corruption can be minimized. There's always going to be some financial incentive that's going to get in the way of providing the best, most optimal health care. But I love the way that we're talking about how do you change our mindset from treating sickness to staying healthy. This is so key. Do people know what foods make them well and what foods make them ill? There's a great deal of a lack of awareness about what is good for you to eat as opposed to what is bad for you to eat, and that it has an effect on your overall health. That you will be more prone to succumb to illness if you do not have a strong immune system that you have been feeding the proper ingredients to. So this is an educational part of it. There's a policy part of it. There's an educational part of it. And I tell people always, learn how to learn, because the information out there is changing. So what we know today, we will know different things tomorrow. And so you have to keep learning. It's not enough to go through med school and stop learning. You have to continue to learn, and you have to learn how to learn. What sources of information are valid and which sources of information are not. These are decisions, and your decision making will improve. Your discernment will improve. The more you do it, it's like a muscle. You'll get stronger. You'll get better at being more discerning about what is a good, trusted source of information and what is not. Because there are people that are trying to teach you, they're trying to persuade you to think that everything is okay the way it is. Don't change it. They make all sorts of arguments that might sound persuasive, but they aren't if you analyze them. So get to the people who have analyzed them and are telling you the truth, and then pay attention to them, what they're telling you. And this is not easy. I didn't say it was, but this is what we have to do today. This is how we as individuals can change our approach to keeping ourselves healthy. And then we have to work on getting the elected officials that we want, that take this to heart and will push for things like universal health care, so that everyone can be, when they are sick, can be treated and become well again. The emphasis on wellness is critical. And also the advances we're making are remarkable. Like the COVID virus hit us, and the response was, one vaccine was a fairly traditional vaccine, and the others were messenger RNA vaccines. This is a novel solution to a novel virus. And these messenger RNAs have multiple applications. Maybe, I don't know, maybe it'll be the way to treat cancer in the future instead of this horrendous radiation and chemotherapy that we're doing now. It's just horrific to have to go through that. But maybe we'll have something that we can introduce, like a vaccine that will target those things in our bodies that are making us sick. And this is the future, the way that I hope unfolds. And I think if we focus on that future where people are electing officials that care about the people, because the insurance companies don't. They're just caring about the numbers. It's not that they're bad. It's just that that's what they're told to do, and that's what they do. So, they do the numbers, and, you're a statistic to them. But to an elected official, you should be a voter and take charge of your voting power and vote for the people that have your best interest in heart. And listen to the people who are telling you the truth, because it's out there too. There's a lot of nonsense out there, people trying to persuade you against your self-interest. And you'll learn which ones are which. And this is why we have shows like this, Sharif. It's such an opportunity to help people, to empower people to take charge of their own lives. And you have to, if you have a healthcare system, whatever it is, you have to be your own advocate. And I'll stop there for now. Thanks again, Sharif.
Thank you. Professor Donald, before I start discussion with you, I just want to add some statistical info, how many people actually get vaccine in different countries. It will help you to give some analysis on that particular informations. I'm just sharing the information right now. Okay. Can you see these statistics? Okay. This is statistics actually based on the coronavirus vaccines, our world in data. So I just try to understand that like different countries present conditions, the shares of the people vaccinated against COVID-19. This data from July 12, 2021, and from there we are observing United Arab Emirates, 66% people already get vaccine. Uh, then Uruguay 56%, UK 51%, Israel 60%, Bahrain 60%, Spain 47%, Italy 39%, Germany 43%, Hungary 54%, UK 48%, USA 48%, France 37%, Turkey 21%, Brazil 15%, Serbia 38%, Mexico 16%, India 5.4%, Russia 13%. I just want to share some quantity. India 74.85 million, USA 159.5 million, Brazil 56.81, Germany 35.78 million until 12th July 2021. Anyway, many country like Bahrain, Uruguay, Serbia, Hungary, Israel, United Arab Emirates, India, United States, Germany, UK, Turkey, Italy, France, Mexico, Russia, they're doing well. But beside that, Malaysia also Malaysia, Singapore, they are also providing their vaccine and everything. Uh, but what is your observations? Like, do you think that number one, without vaccine, actually we can save a lot of human being? This is number one. And number two, do you think that the developing nations, not only from Asia, even I want to say, even I think Africa, they do not face that kind of challenge because what happening in Asia Pacific right now, but we never know, maybe Africa also can move with a different situations. What do you think? Like the developing nations, huge amount of populations, still they are not getting vaccine. So what we are creating a safe world, or it will be more challenging for us?
Um, Great. Yeah, that's a great question. I want to answer that and something else that you asked, but I want to mention a couple of things, just a couple of things about what to add to what the others have said. The huge leap in lifespan, when you calculate lifespan, what you do is you take the age of everybody, just like you would calculate the average height. You add up the height of everybody in the room, and then you divide it by the number of people in the room. So lifespan's calculated by adding up the age people died and then dividing it by the number of people. And what's happened in the past is that the truth is if people don't die, they live to about the same age they live now. But there was all these ways that people were dying, infant mortality, and especially infections. And so the invention of the huge leap in lifespan was basically because of starting to use antibiotics. And otherwise, it's been slow going to actually extend a person's life. And it's, we're not sure. And I also want to say, I live with a primary care medical person, and I know quite well how their clinic works. And they serve people who can't afford medical care, people, undocumented immigrants, poor farm workers, people like that basically can't afford medical care. And they get as good a medical care as I do at that clinic. And in that clinic, they have behavioral health, nutrition. One of their biggest problems is diabetes, so they're constantly counseling people. The kind of diet that people eat that come from Latin America is very high in carbohydrates, beans and rice and corn and things like that. And so they work very, very hard to try and get them to change their diets to better diets. And so I think it's a little harsh to say that the system is only about fixing problems. Even me, with a good insurance, my insurance company, and they fight with insurance companies all the time. I agree that insurance companies definitely, have their own agenda, and the medical professions have to deal with the insurance. They have a whole department to deal with the insurance companies. I mean, that's why there's no independent doctors anymore, because it requires so incredibly much work to deal with the insurance companies. They just couldn't do it anymore. And but that's a whole other thing. But I get a thing even from my insurance company saying, we'll give you a $50 Amazon gift card if you get your annual checkup. And the annual checkup's included. I mean, there's no copay for that or anything else like that. And so there's a lot of work going on to get people to basically take care of themselves better. Their nutritional counseling, all of that is all incredibly low cost or free nowadays. So I think we're it's a little bit of a straw man. I think that we're talking about the medical system from years ago. One of the two successful vaccination programs that are we can talk about is the smallpox and polio. Now, smallpox people just kind of think is a bad case of chickenpox, but it was actually closer, about 25% of the cases, it was closer to Ebola, where you'd be bleeding at your eyes and die a horrible, miserable death. It was a hemorrhagic fever disease, and killed hundreds of millions of people. It was really bad. And through coordinated efforts, and basically they made laws at the time that you had to get vaccinated. They were the governments, and what I'm going then to the corruption thing. I don't know as much about smallpox as I do about polio, because I'm a member, I'm not right now, but I've been a member of the Rotary Club. And what happened was, when they were the World Health Organization was trying to tame polio, what happened was that exactly what you're talking about, corruption, kleptocrats. You give a country money to buy polio vaccine, and they use it to wallpaper their mansion or whatever. And so it wasn't happening. So what happened is the Rotary Club organized, because there's Rotarians in every country but North Korea and Cuba. And they started taking the vaccine and distributing it through networks of Rotarians. The Rotary Club is a very large organization in India. There's a lot of Rotarians, and it's a very prestigious organization. You have to be a community leader to be in the Rotary Club. And so the Rotary arranged for the vaccine to get there, and for a vaccine day. And catch this, they vaccinated 150 million people in one day. And so it's possible to do these things to circumvent the corruption, but you have to go to the NGOs. And I mean, I can talk to some of my Rotarian friends, because the Rotarian is this network. So if you find a problem and you find one Rotarian, that Rotarian can get you to the right group of Rotarians, because Rotary is sort of like a franchise, and each individual Rotary Club is basically does their own thing, and it's subsidized by Rotary International, which all Rotarians donate to on an ongoing basis. And so you need to find the clubs that are willing to do that and can do that, and then they can organize to make things happen. So that's just one example, because then after the Rotarians were so successful at eradicating polio, and Bill Gates jumped in and donated an S-load of money to make those kinds of things happen. So Gates is another person that's very, very into vaccinating people and working on that. Another analogy that starts getting into the problem is AIDS. And when you get where I'm going with this is about basically non-medical, non-pharmaceutical interventions. And so it's something that you don't really think about, but there's a lot of countries in the world where buying condoms is so expensive that people just can't afford them. And the best thing to prevent AIDS is condoms. And so if AIDS drugs are important to maintain because of the people who have AIDS, and incidentally, half the AIDS drugs in the world come from the Clinton Foundation, the evil Hillary Clinton. And and so if that's an issue, that's who you contact, is the Clinton Foundation. And then but there's things that we don't even think about medical technology, is that in many countries in the world, women drop out of school because they don't have sanitary pads. They just, things to us that we would never even consider to be a problem are a huge problem. And there's technology now that's been making sanitary pads, in biodegradable sanitary pads for low cost and distributing them to developing nations. And these kinds of things, these simple things, and with COVID, a kind of a way that technology has helped us that's not drugs is the modeling. And it was actually computer models that got us to understand about social distancing and closing the schools and various kinds of things that greatly reduced the spread of COVID. And you have to remember that, like New Zealand and some other countries dropped it to zero without a vaccination, before the vaccination. So it's possible to use non-medical interventions to greatly reduce and even eliminate COVID in the cases that we don't have the medical interventions of the vaccines. So I think that by using NGOs, you can get the vaccines more widely distributed, and by just using non-medical and get around the corruption. And with non-medical interventions, anybody can do that, no matter how corrupt your government is. And so there are ways to work on that, but we have to think a little bit differently, because it's not like really sexy technology advancements. It's kind of, good management is a technology. So the Rotary Club's ability to do what they do is a technology that's very sophisticated. So I'm going to end there and let other people talk.
Mr. Martin, can you hear me? Mr. Martin, can you hear me? Mr. Martin, can you join again? Mr. Martin, can you hear me? Okay. Professor David Smith.
I agree with everything that we've heard so far today, and it's been just a wonderful topic. One of the things that we really should think about as we go through this is where we've seen huge breakthroughs that have helped us advance where we are and where we're going. We've talked a lot about genetics and mapping the genome and all that, and that's very groundbreaking. But there are some others that are less apparent that have been equally as groundbreaking. One of these is really magnetic resonance imaging, or the MRI. The MRI has given most physicians an eye into your body and how it's functioning, and how things in real time are happening in your body. The X-ray was a tremendous advance before. The MRI has taken that and brought it to a new level of science that is affecting healthcare. You know, in some ways, the functional MRIs almost are making it possible for doctors and science to virtually read your mind, to virtually read your body with the new advances of the functional MRIs as opposed to the regular ones. And this has really made a big breakthrough. One of the areas that in my lifetime has been a huge breakthrough in healthcare has been tackling heart disease, cardiac disease. My grandfather had cardiac disease, and I grew up with my grandparents. And there was very little that could be done for him. And even the medicines back then, it was saying, mix these two alcohols together and drink them. And that was some of the ways they dealt with heart disease before. Our advances of controlling heart disease is very much forward. Cancer is a horrible, horrible disease. I was fortunate in the past, and I was a presenter and on the steering committee for the National Cancer Institute in the United States. And Andy, who was the head of NCI at the time, we held a workshop on trying to put in place a plan to alleviate the pain and suffering of cancer by 2035. And cancer has gone so far. I mean, if I go back and look at the history of treating cancer, when I was born, there was not chemotherapy, there was not radiation therapy, there was not Cyberknives, there were not all these other advances that we have today. And the problem with many of them is they attacked not only the cancerous cell, but healthy cells as well. And with all the different breakthroughs now that we have in there, we have approaches that interfere with the spread of cancer by blocking the cells that do it. We have ways to identify and just the cancers. It's really interesting. In the last 2 years, more than 25 new drugs have been approved for treating cancer. That's unheard of. That type of focus, that type of output, that type of number. And so we're doing a lot of things in there. You heard me mention before in cancer, the Cyberknife. To me, the Cyberknife is really some of the epitome today of minimally invasive techniques that can be used to do surgery. You know, it was a great breakthrough when robotic surgery came into place. But robotic surgery still involved incisions. It still involved all the different other elements. And the Cyberknife is an extension of that without the need to have an incision, and beginning to do things where for disease states that's really possible and can be done. And in many parts of the world, particularly developing nations, infection from surgery and from time in the hospital is a real killer. And this is a way to help reduce that. My mother passed away last year. And yes, she went into the hospital for a condition and had complications while she was in the hospital. But what is on her death certificate is staph infection is what eventually killed her. And so the need to deal with ways to have control infection, to be able to control infection within the healthcare system is still one of the grand challenges that we have to work on and adapt to. It is as important to control the infections as it is to treat cancer and to treat some of these other diseases, heart disease and like that. And it's one of them where we have to go. You know, there's so many others in there. You know, if I look at prosthetics, And, we now can do smart hands that our smartphone can control. We can do smart limbs that our body worn, our smartphones can control. We're getting all this intelligence in the systems going forward. We're seeing nanomedicine and nanotechnology go into healthcare in just very interesting ways. Over the last decade, more than 130 drugs based on nanotechnology have been developed. And we're now delivering nanomaterials and even nanorobots in situ inside the body to target and go and address very interesting things. I love what we're seeing now is that I can now 3D print parts from eyes to teeth to skin to elastic bones to bionic ears and even ovaries, which just surprised me when I saw that and what we can do. And there's many others. I could take a list of technologies that have been developed in the last 20 years, and I could fill the rest of your program talking about them. And that's not the goal here. It really is one to say we live in a time where the technologies, the science are outpacing in some ways our ability to put in place policies that can work with our science, to put in place support mechanisms that can work with our science, to make the science of healthcare affordable. There is a new Alzheimer's drug that's showing very promising effects. The challenge with this new Alzheimer's drug, and it is a genetic rDNA drug, it costs $25,000 for each dose. And, I would love to see us be able to look at things like that, optimize them, and spread them throughout society in a better way. We're at the best of times and we're at the worst of times in healthcare as it comes forward. And our ability to treat the individual has never been higher. So in the past, we treated the individual and did it for them. Where we're moving now is we're doing personalized medicine, but based on populations. And that is the big trend, also moving from fee-for-services into value-based, quality-based medicine, is the whole dynamics of that treatment plan really changes. I just want to kind of go back and just touch a couple of things to wrap up on that one. So, Donald and has talked about, and so has James, talked about the insurance side and the payment side. And, we've gone from a volume-based fee-for-service to more value-based, which is outcome-based. But, you look at how the incentives change. In the past, they were just, how can I do my traditional healthcare value? Where our values and our incentives are based on wellness. The focus has changed from dealing with episodic healthcare to dealing with population healthcare. The role of our doctor has changed. And our doctors before were individually based, the person who delivered most of our healthcare. Today, it's becoming a team approach. And we see that throughout the entire healthcare system. And it's becoming one where geography is less important. The rise of telemed, the rise of remote surgery, the rise of all these other things is making geography much less important today. And finally, I think one of the huge changes is healthcare is changing from being retrospective to being predictive. And this change from retrospective to predictive is what will dramatically force countries and society to readjust its view on healthcare.
If I may jump in, nice to
Yes,
meet you.
yes, you can.
What I think when we talk about healthcare, it's also important to distinguish which level of healthcare, because I mean, me as a Swiss citizen and living in Zurich, I know that lots of people from Asia, from Russia, from the Middle East, they come for medical treatment to Switzerland, as an example. And lots of pharmaceutical companies, they charge huge amount for their drugs for being distributed globally. So I think the basic healthcare, I agree, this should be very local. Actually also the advanced healthcare, but I think it's just not the case for advanced healthcare. Because for advanced healthcare, you need such a lot of specialists. And when you see, as an example, the COVID in India, when with the oxygen that people had, with that people didn't use the full standards that were supposed to be applied, then I think lots of these things, they were not sufficient. I mean, it's a little bit unfortunate, but in less wealthy countries, often it's a little bit a lack of the infrastructure, of the trained people who really do it properly. I mean, it always depends to quite a big extent to what type of healthcare, the basic facilities, and I think most can be done with the basics. But I mean, for the very specialized, I think in urban areas it can be quite difficult to achieve.
Mm-hmm. Mm-hmm.
In particularly rural areas as well, though.
Yeah, I agree. Yeah.
Mm-hmm. Like, can you share with me about the Switzerland present conditions of COVID and how they're managing the whole things? Your experience with our audience.
Yeah, well, in Switzerland, it was actually not something to be proud of, because Switzerland had a pandemic plan, but afterward, basically, it was not fulfilled. And I think Switzerland has a population of around 8 million people, and around 10,000 died of COVID. So it's not very good in the statistics. And Switzerland is a wealthy country. At the beginning we had a lack of masks and all the other things, like many other countries as well, and the response was very slow. Now the economy almost opened up completely again, and especially last fall, so in last September, when the numbers were rising again, then in Switzerland it was a very lack of action, so that people were congregating indoors, and I mean this helped the virus to spread quite a lot. And so the reaction was always very delayed. So I think Switzerland is not the best example how to handle a disease like COVID. I think the good examples are more in Asia. Maybe not India now, but I think places like Taiwan or Thailand, I think they managed it quite well. Actually, whole Europe and North America, South America, did it very poorly.
Mm-hmm. Mm-hmm. Okay. Yes, Professor Donald.
Yes, I will say there's a wonderful book called The Premonition, which is basically talks about how the social distancing came to be. The idea of social distancing, and it was from models. It was from a mathematical model, and it was tried first in California, which has the lowest per capita, or almost the lowest. Hawaii has the lowest, but it has one of the lowest per capita rates of COVID of any state, and we had a lot high numbers, but we're the biggest state. large. I want to mention one thing going back to the corruption issue is that a lot of people are in a position where the drugs that they get aren't real. So there's a huge problem with counterfeit drugs where people just, print up the boxes and fill them up with sugar pills. And the placebo effect is, works sometimes, but it doesn't work very well with AIDS or COVID. So that's something I don't really know quite how to address, but it's something that really does need to address. It requires infrastructure in the country to be able to police those kinds of things. And there's a lot of criticism of the system of vetting drugs in the United States and elsewhere. And from what I've read in the Journal of the American Medical Association and places like that, this new Alzheimer's drug targets amyloid plaques, which they're beginning to just think is not really the cause of Alzheimer's disease. It doesn't really help. And there's people in the FDA that were so upset that it was approved without being vetted well enough that they just quit. They couldn't morally, put their signature on having the drug being released because, as it said, it's $55,000 or something for a treatment, and it doesn't work. As far as we can tell, there's no evidence that it works. And that's kind of the problem, is that when you're doing a test of something like a drug, or you're doing something, I work in social sciences, when you're doing a statistical comparison between two populations, the only thing that works, the absolute only statistical method that will give you a positive results is double-blind trials. And those can be very difficult and expensive to do, especially when you're doing it on a group of people that are just running around telling you what they're doing, because you don't really know if they're actually doing what they say they're doing. And so it's very difficult to test these drugs. And a consequence of not testing them, or even giving the illusion that they're not tested well enough, if you look at vaccine hesitancy in the United States, one of the major reasons is that people say, I don't want to be a guinea pig. It wasn't tested well enough, and I don't believe it's actually not going to kill me. I mean, there's other conspiracy theories, like the idea that they put a microchip in it. Bill Gates did, to track you. I don't know. I don't think that's true, but I do know that I hear a voice in my head when I go across town asking me if I want to connect to different Wi-Fi networks.
Yeah. What I think, what is also very crucial, as an example, when you see the communication from the World Health Organization, so one of the top organs that should have managed this pandemic, I think it was more harm than good. Because when there's such a lot of misinformation, and covering of people and of other organizations, countries, and then, I mean, you can't really be astonished anymore if people don't trust anymore the official information, or if information comes with such a delay. I mean, when you say, as an example, with double-blind studies, I mean, lots of traditional medicine, it's probably very hard to do the double-blind studies, especially for therapeutical measures that can't just be on and off, that also need some maintenance. So I know from a statistical perspective, it's very hard to test, but I think measures like this, they could help as well, but sometimes it's also hard to get the right metrics to test them properly.
That's true. And so what wound up happening with the COVID situation is that it was so new and so little was known about it. It appeared to be a respiratory disease, and it turns out that it's a lot more than that. But what they did initially is they made analogies to flu. And so, for instance, people were fanatical about washing their hands all over the United States, and it turns out it doesn't pass that way. It passes through aerosol in the air. And so the World Health Organization and others were just looking at clinical evidence from other diseases and guessing, because they really needed to do something as quick as possible. And as time passed, they actually then started getting actual evidence, so that based on the evidence, they started changing their directives. I followed it closely in top journals like Nature and things like that, and it was basically the scientific process being open to others. I mean, us scientists know that we make hypotheses, and many, many times we're wrong. And the fact that we're wrong is just as valuable as the fact that we're right. But people that aren't trained in science really can't understand that. And so they just look at it as us being, undecided and not knowing what we're talking about and things like that. So that's, I think that's an issue. And it goes back to what James is always saying, is that, we need to learn about these things and teach people about these things.
Yeah, I think it's also always very important to set the right narrative and to have an open communication, because when the narrative is just vaccinations are 100% sure and 100% harmless, and then people find an exception where something happened, then it has basically a counterproductive effect of the initial communication.
That's true, but as James says, you really have to be careful where you get the information, because I've never seen that it was 100% effective anywhere. And I've seen, I mean, the numbers that they gave were that it was like 94% effective, but they said, but those were in controlled circumstances, and so they weren't really going to know. In fact, there's a different name. There's efficacy and effective. So I think it's efficacy is what happens once you get into the population and they get enough data from actually using it, that they can then get, come up with a better number of how likely you are to get it. But I do know that it's like the number of people who've actually died is minuscule. And I mean, we're talking about 0.0001%. It's nothing. But as you said, people take anecdotal evidence as more important than scientific evidence. So if they hear a story about somebody who knew somebody that, had a problem or something like that, they take that as more true than they would from institutions. And I'm sorry about the erosion of institutions. We had a president that deliberately, and he's backed by organizations that are deliberately trying to undermine organizations in the United States and the world. And that was a very sad thing that happened at the same time that COVID happened. Though Dr. Fauci is far, far, far more trusted than on medical than that creep ex-president of ours. So, I don't.
Thank you, Mr. Jamsid. Mr. Jamsid, I think you want to add some point.
Well, I want to thank you for the discussion in general, Sharif. And I always love being on Donald. It's a pleasure to meet Martin. And I wanted to thank David for his optimistic approach to this, because, I think that we look at problems, we have to be realistic. When we come to solutions, we have to remain optimistic. And we talk about the change and the accelerated pace of change in our society now, including in medicine. I know that in the 70s, I stopped taking psychology courses because it was basically, you could see the input, there was a black box that was our brain, and then you could measure the output. And that was basically all we had. And now we can see which parts of our brains light up when the input starts. And so this is a tremendous advance. And if I had taken psychology courses at this time, then maybe I would have been more interested. But the thing is that we are advancing. The advances are ahead of our real understanding. Sometimes the technology has to, be adapted, and we have to learn to trust it. And yes, in the United States, we have lost trust. We have lost trust in our institutions. There's no question about it. Can we regain it? Regain it? Yes, I think so. This concept that Donald was talking about, like we had in our country, institutions like Skull and Bones for the very well-connected, to keep the well-connected employed and have opportunities that other people simply did not have. And the answer to that for the rest of us has been the Rotary Club. Shout out to Rotary Clubs. They really, really are an example of people that work together, because a team can do more than any one individual can. And these people work together to share information and to implement the understanding as best they can to their communities. And this is the approach, I think, in general to healthcare. And also, I've been writing about appropriate technology since the 1970s. And appropriate technology means something like, don't build a windmill where there's no wind. So do it where your environment is. Do what's best for your environment where you are. So start locally, then build. Start with yourself, and then those in your sphere of influence, and then they can pass it on to those in their spheres of influence, and it can grow, and who knows where it'll stop. Start with yourself. Get your message accurate. Get your message truthful, and share it. And share it, and you will find that we grow, and we don't know how much we can grow and how many people we can influence. And this will change our way of our voting patterns also, hopefully. And we won't vote for people that are telling us what we want to hear, but people that are telling us the truth. And I really believe, this is one thing that I've written down that I want to do, I learned today, and I want to change my behavior about it. So I'm going to start talking about quality-based medicine, value-based medicine, instead of what's wrong with the medicine, and change the tone of my conversations from what's wrong to how it can be modeled best. And this brings me to the concept of modeling, testing. And these are so important before we release any new drug into the environment, because we can't leave it up to market forces competing for which drugs can get out there fastest. That's not the best way to do these things. It's not the optimal way, certainly. So we have to spend time modeling. We have to spend time testing. And then we have these questions of distribution. How do we get it to people? And also access. Can people, all people, have the same amount of access? This is a problem that has to be solved. And it is a problem that can be solved. Every problem that we have has a solution trailing right behind it. I could go on, but I will, in the interest of time, allow others. Thank you, Sharif. Great show.
Thank you. I need to go for the concluding remarks for today. Before the concluding remarks, I request all of our audience share our content as much as possible. And thank you, our honorable speaker, those who support World Talent Economy Forum initiative. I want to start from Professor David Smith, then Mr. Martin, then Mr. Donald, and finally Mr. James Ed.
Thank you as well.
I want to start from Professor David Smith.
Sorry.
Yes. Okay.
Yeah. I mean, I'm not a health professional, but what I think is important is basically, as an economist, to see the basics, what are needed. So basically that the basics are fulfilled at the places, and then start from the basics, that when they are done, then basically the other things are top off. But first, from an economic perspective, things like good sanitation and all these things should be first covered, and the expensive medical treatments basically as an add-on. Because when you see, as an example, life expectancy, the main impact of that is that there's not a lot of child death. And good nutrition and all these things, and poor sanitation, all these smaller things that can be done quite easily, I think they should have priority. And for the other thing, for the drugs, I mean, when you see medical research, it should not only focus on drugs, because I mean the body is a very complex system, and when you just have, for most things, for some things it will work, but when you just have a very small trigger on or off, it might work for some things, but for others, like pain or depression or things like this, it might also have a counterproductive effect. And when people overconsume drugs, then it may go that people don't trust it anymore. I think this should also be considered.
Mm-hmm. Thank you, Mr. Martin. Professor David Smith. Professor David Smith.
I think he's already gone.
Yeah, he sent a note that said he has to get off soon. There you go.
Professor David Smith. Professor David Smith, can you unmute, please?
David, we can't hear you.
I think he's on mute.
I do too.
Okay. In that situation, Professor Donald.
I want to mention one thing that goes along with what David has been saying. I met a woman, I don't know, in the last year who had stage 4 lung cancer, which is absolutely 100% fatal, and there's no treatment, except she got completely over it. And exactly what David was saying is that it was targeted. If you didn't have the right genes, the treatment wouldn't work. And so she just had the right genetic profile to get a treatment that 100% cured stage 4 cancer. It's pretty amazing. But I go back to what Martin said, and what I've been saying is that there's simple things that people can do, like, for instance, as I pointed out, the Asian countries like Taiwan use social distancing and masks right from the beginning, and it worked. I mean, I know somebody that moved to Thailand and with his family, because his wife was Taiwanese, and he was writing us back that he could go to movies, he could do anything he wanted in Thailand. In Taiwan, because they'd effectively tamed the virus. As I mentioned, the thing about sanitary pads, I mean, it seems like nothing, but many, many girls have to drop out of school because they don't have access to basic sanitation. And there's also water purifiers, because when the lifespan, as I said, is the average age that people live. And if kids are dying of cholera and things like that when they're infants because of bad water systems, as I pointed out in the show before, in countries where people poop outside, the water is much worse. And so Bangladesh had an amazing project inside of Bangladesh that created latrines for everyone, or many, many people. So it kept the poop out of the water, and the death rates for children and everyone went down. It's not just a medical issue. It's if kids have diarrhea and other kinds of things a lot when they're infants and young children growing up, they don't thrive as much. They don't learn as much. They're not as healthy. They can't contribute as much to society. Corruption, needs to be gotten around, like in the case I was talking about of distributing the polio vaccine or others. NGOs have to get around these governments, because they're changed, they're kleptocrats. That's what they do, is they steal the money from the country. And that's what they do. But again, non-medical interventions like having good drinking water, and in the case of COVID, just following the rules, social distancing, wearing masks, not congregating inside in groups, various kinds of things like that can totally change and even eliminate the virus. So your initial question was about corruption in the medical field. Oh, I'm going to say one other thing about that. The drugs companies in India are very good. And in fact, they provide, I think, some of the medication I take, it comes from India. And I got a list of the 4 countries that are doing the most in medical research, and besides the United States, and India and China and actually Canada and the UK were in there. But it's heartening to see that the various countries are stepping up to the plate and starting to do valuable things themselves. And that's what I'm going to say.
Thank you, Professor Donald. Professor David Smith, can you hear me? I'm sorry that some miscommunication. I'm sorry about that. Can you hear me?
We can't hear you, David. You're muted.
Why? Okay, you should hear me.
There you go.
Yes.
Yep.
Let me finish with this way and kind of help stage it. You've heard a lot of my comments about where technology is going, where some of the policies going. But one of the things I think many of us in the panel can relate to is that if I look globally, by the year 2030, the number of people over the age of 60 is going to increase by 56%. The number of people over the age of 80 is going to double. And, this shift of healthcare for an older population, I hate the term the politicians use. The politicians call it an aging population. I really think it's an older population because some of my friends will tell you I still act like a 21-year-old. So, what can you say with that? But this whole movement of going there is going to cause us to need new thoughts, new minds in healthcare leadership and administration. That is really going to be necessary to overcome these problems. And it's going to cost us a lot of resources to do it. If I go back over the last 15 years, there's been an acute downward trend in the number of people entering medical schools. But yet we have growing population, we have growing concern. So the way we deliver professionals into the healthcare field has to change. COVID helped accelerate that. We've seen medical paraprofessionals take increasingly larger roles as we deal with the overcrowded hospitals, the need for remote healthcare and others. And we've seen that vaccinations can be delivered in the grocery store. That's where I got both of my COVID shots, were in one of the large grocery store changes here in Austin, Texas. So we've seen that impact really of the changing profession of healthcare delivery. The other big healthcare crisis that COVID has actually accelerated is the mental healthcare crisis. And we've changed so dramatically how we approach and deal with mental health. It is one of the areas that we really, really still have to change and still have to understand the nuances and make the services available, but also understand that there's some uniqueness in healthcare that we still don't, in mental health, that we still don't understand. And actually, the final way I want to kind of wrap up is a really personal one to me. I have an adopted son who, like many adopted children, they come with a set of special needs, and he did too. And it's how do we craft out through the policies? How do we craft out through society? How do we craft from all our resources healthcare that can work with people who are outside the narrow part of the bell curve? And that's one of the things that as we move further into population management and things, we will begin to understand those issues better. And my final point is, again, another personal one. Some of you know I work at a company called Economic Transformation Technologies. And one of the things we're doing in social emotional learning and in healthcare is we're delivering chat bots into the thing, not just normal dumb chat bots. We're developing 3D avatars that can speak in natural language, that can understand in natural language back from the people interacting with it, that can do this in real time. And I think part of the future of healthcare, part of the future of mental health is really beginning to use things like these very advanced AI enhanced, natural language enhanced avatars to begin to make basic healthcare available everywhere and free up the advanced healthcare for the people who dramatically need it. We're seeing these type of advances coming. We're in the process of filing multiple patents around our approach to that today, but our goal to this is to move it to developing nations, because these are the things that equalize the playing field for developing nations. And it takes a decade to bring a new doctor into their own to deliver healthcare. Let's do that, but let's use these other technologies to help and elevate the level for all. And I think that's where really the future of global healthcare is going to be going. Sri, I love doing these
Thank
for
you.
you. And
Thank you.
thank you
Thank
so
you,
much.
Professor.
The other call I'm actually on right now is with a company in UK. I showed them the picture of your screen with all these distinguished people on it. They almost
Thank you.
said, let's just listen to this. So thank you so
Thank
much
you.
for letting me be
Thank
part
you.
of it.
Thank you, Professor David Smith, for contributing World Talent Economy Forum. Mr. James Seed.
Yes, I double down on that, Sharif. Thanks very much for inviting me and the rest of the panel for this discussion on this crucial topic. And I want to do a quick shout out to New Zealand too for their handling of the COVID situation. They were a great model for the rest of us. And I want to, I'm going to do my typical, we're all in this together, and it's not our job to build walls to keep us apart. It's our job to tear them down. We have to build bridges. This will help our distribution. This will help us get what's needed for two places and people that need them. And this is the kind of thing that we have to change in our society. We have to start with our minds and also with our hearts. We have to lead with our hearts. And if you think you can't be part of the solutions, you're just another brick in the wall. So take power, take charge of yourself, change yourself first, change those in your sphere of influence, and then keep letting things percolate out from the ground up. And we will make change in our society because change is necessary. And we start with our voting power. We can start with anything you want to start with, but change. And be open to change. Don't be afraid of it, because our fear-based decision-making is always suboptimal by definition, unless it's diving out of the way of a bus. But when it's coming to something as complicated as healthcare, what did I say? I just say quality-based medicine. We want to be calm, cool, and rational when we're thinking about this. And we want to be realistic about what problems are and optimistic about what the solutions are. And what's true value? What has true value? It's health, not wealth. So when we apply appropriate technology, sometimes it's not always a free market capitalist solution. And it's not who makes the most money, but how many people are well. How many people can live lives of quiet dignity? And this is our goal. This is our goal, health. And all of the ways that it's come under attack in the 21st century, we have novel ways of approaching these solutions. But it's not always appropriate to use the same tried and true methodology, because what is contained in that methodology of profit making is not always consistent with what's the true value here. We're talking about health, not wealth. So these are the types of things that I want us to change. And also, it says it's Statue of Liberty. It's not the Statue of License. You can't do whatever you feel like, and it's your civic duty to socially distance and wear a mask. It's not your job to do whatever you want. It's your job to be a socially responsible citizen of your community, and then also a citizen of the world. So these are the types of things that I wanted to close with. And be aware of statistics. Be wary of them, because if you have 9 months of drought and 3 months of flooding, your average rainfall might sound like the same as something that has a consistent rain pattern where you can live throughout the year, grow crops and eat them, and all of that. So what's happening in our environment now is changing the extremes. So we're feeling extremes. And what we're solving in some of our solutions are technology based. And what's going on in the medical world now is marvelous. But these are marvels. They're not miracles. These are people coming up with these solutions. These are people that are implementing them in our societies and making them available. And we want to increase their ability to make them available to all. Because access, distribution, access, these are parts of the system that we have to keep in mind when we're designing the solutions. Because it is a system that we're talking about. So we want to make sure that we have the access. We have the means of distributing the technology that we develop and getting it to all people, whether they're your best friend or they're someone in a remote country that you will never physically meet. And so this is the things that I want us to change our mindsets about, and don't bow down to the false god of technology. Technology will always bail us out of everything. No, technology is not the only answer. There's a lot of other answers, which is cooperation. For example, between people, between countries. It doesn't matter what country you're from. It doesn't matter what language you speak. We're all in this together. Thank you, Sharif. Wonderful show.
Thank you.
Really appreciate it.
Thank you. Thank you, everyone, for joining today's sessions. Please share our content as much as possible. Thank you for all of your support for World Talent Economy Forum. Thank you, Professor David Smith, Professor Donalds, and my friends, Mr. James Eade, for your continuous support for World Talent Economy Forum. Bye-bye and take care.